We all set, Andrew? Okay, so this is Knox County Board of Commissioners regular session January 23rd, 2025. In our room at this point, we have Cheryl Splain from the news. Her email address is MV editor. And Penny Doyle is our clerk, also here taking notes. County Commissioner Drenna Cassie, Barry Lesser, myself, Bill Purcell, with Jason Booth as our county administrator. And we also have Emily McConville with us. And we will have Kay Spurkle coming in a few seconds. We decided we'd go ahead and get started while we're waiting on Kay and do some of the resolutions that we need to do in this session. So Jason, I turn it over to you.
All right, so commissioners, we went out on site to potentially vacate the unnamed alley in Clinton Township. And the county engineer was in last week, and he has formally given us a recommendation to approve the request from the township trustees in Clinton Township. And so it is ready for you to approve that if you would so like.
Is it the approved part, or did he say something about the whole alley, Jason?
It's just the part that the township.
Township
trustees
requested,
asked.
okay.
Yes. Yep.
So other comments before we do a resolution for that?
Yeah.
Okay, could I have a motion then to approve that?
I motion we approve.
And all those in favor say aye.
Aye.
Aye, thank you. So Kay, will you join us here at the table? We weren't sure how long it was going to be for you. We figured maybe with your truck, you had a 50-gallon gas tank fill up.
Well, no, it was the semi that went 40 miles an hour the entire way up Route 3.
Welcome to the country, right?
Right.
Yeah, well, we appreciate
So,
that
thank
you
you.
and Emily coming and you know, sharing with us about to give us an update for the mental health and recovery for Licking in Knox County. And didn't know whether you were gonna have Vince here with you today or not. But so it's turned over to you and we are live streaming. So make sure that you don't use any profanity that the Andrew has to bleep out.
Right, this brings back memories of 2020. Yeah, absolutely. Emily, do you want to start by talking a little bit about what we're doing right now and how it impacts the county?
Anything in particular?
Well, let's see. So first, maybe the best place to start is to maybe back up a little bit. I'm Kay, I'm the director of the board. It's very nice to meet you all. And I guess just to explain a little bit of what we do, about what an ADAM board is. So in each county in Ohio, according to statute, and we have our own statute, it's 340 of the ORC, outlines that an ADAM board or a mental health and recovery board is to monitor and assess and fund services needed for residents of that county. And so there are in Ohio 50 ADAM boards. Obviously, there are 88 counties in Ohio, but there are 50 ADAM boards, and some boards have a single county that they serve, and some, like ours, have a service district. And so we have had the pleasure for the last 50+ years serving both Licking and Knox County. And what that means is that for our service district and how we are funded, we actually, each county has its own levy. We've been very blessed in this county for years to have had the generosity of the taxpayers here approve a levy, and that has helped purchase services for children and for families and for adults that have addressed all sorts of mental health and addiction issues, and including prevention. We're a very strong supporter of prevention. Our services are universal services. That means we serve everyone. We, like yourselves, are public servants. So we have, we've also had the ability over time, when we make our decisions, we don't make them in isolation. We make them with a whole number of other community partners, which would include the sheriff's office, our police department, schools, other social services, other businesses, things such as that. And again, in Knox County, we've been very blessed to have been able to have had really wonderful partnerships in the past, which has really helped us, we think, try to bring the best quality and the most effective services to the residents of this county. I would be lying if I did not say to you that we will be having our next levy come on the ballot in November. That's what our planning is right now for both counties. And my joke over the years has been, there are three things I'm particularly feel incredibly proud of. One is giving birth to beautiful daughters, two, toilet training them successfully, and three, passing two levies in my first year of employment as a board director. So we will be calling upon you in the future, but we don't need to get into that today. So I guess the other thing for you to know is a huge role that you play, and how you play into this process is you do have a say in our decision-making at a board level. We are an 18-member board. Knox County has 6 of those members. And currently your board, our board chair is from Knox County, and that's Rick Landuza, who's also the chief of the ambulance services. I never remember Rick's title. I should not have known it for years, of Fredericktown. And Rick has been very involved. Our next upcoming chair will be Stacy Baxter, who's also from Knox County. And so your leadership, even though you have less board members, is very important. So if we go back to the fact that we are a service district, board members in Licking County vote on what happens in Knox County. Knox County board members vote on what happens in Licking. And I will say that both sets of our board members from both counties are very, very thoughtful about the other county. We, as a staff, spend a lot of time educating them about whatever issues come forward to them for their consideration. And we, in the future, we believe we have a candidate for your consideration for appointment. We are currently vetting this person, and my board will be meeting with her. And historically, what happens is we bring forth candidates to you that meet the requirements that the state has required of us for, board membership. And then we ask for your appointment and approval. And certainly, if you want to meet with that person, you certainly may. So just to let you know.
Are we shy then one member or someone going off?
Well, so Jen Odenweiler went off,
Okay.
and so we're still filling Jen's seat. So typically, the state gives us a laundry list of the type of candidates we have to have on. The biggest group of candidates, one is somebody who has experience of being in recovery or having mental health services themselves. And 2 are people that are family members. The vast majority of the members on our board have somebody in their family that either has a mental health or an addiction problem. And so when they view and look at the needs of other residents, they certainly understand needs of families and communities. So, I know I just threw that to you,
Yeah.
Paul. Yeah, I'm
It's
sorry. I
fine.
apologize for that. I thought maybe you'd have something you'd want to say, but that's okay.
Could I ask you on the 18 members then, so we have 6 here, then there would be 12 from Licking County.
Right.
Is that based on population
Yeah.
size? Because I know
Yeah.
they're
Yes.
3 times larger than we are
Right.
population wise.
That's based on population size, and we have the option of having a smaller board, but if we had a smaller board, a decision was made back in 2014. If we had a smaller board, Knox would have less representation. And so we have enacted to have a larger board that guarantees you 6 members. So you appoint 3, the state of Ohio appoints 3. And in Licking, it's 6 and 6 is how it goes.
And then monthly meetings, the board, or?
Yes, we do. We meet during the months of September through November, and then we reconvene January through June. And then they get the summer off, which makes them very happy people. We will bring our executive committee back if we need to. So, and I would be happy, I'll send maybe to Jason or maybe to Penny our schedules. You can see where our meetings are. You're always welcome. we are very excited for the new bill that went through because that allows us eventually to do public meetings, which we have not been allowed to do other than during the emergency orders during the pandemic. And it's a lot easier to bring 18 members together in one room to get quorum than it is to have to call meetings in person. Although I will say my board really values seeing one another and being able to interface. Our meetings obviously are public. We invite the public, and for us to move forward with having remote meetings, we have to craft policy. So we will be doing that. I don't expect that we'll be doing public meetings, probably not until next fall. I think it's going to take us that much time since we do manage a large amount of local, state, and federal dollars. We want to ensure that whatever we do in our policies really allows the public to be aware of what we're doing. We pride ourselves on transparency. My board jokes that every time I send them attachments, it's like I'm tearing down another forest someplace in Canada in the amount of paper that we use. But we think it's very, very important that people understand what they're voting on and can stand behind it, or if they don't agree with it, that they can also stand behind that, but they have the information that they need. So all that information is always available to anyone who wants it. And again, because of the amount of money and because we really pride ourselves in transparency, we want to make sure we get it right. So not all our meetings will be remote. Some of our meetings will be in person, some of them will be remote.
And your website is what?
mhrlk.org. So all of the meetings are listed on the calendar on the website as well. So you can just.
Say
hop
that
on
again,
there.
I'm sorry.
It's mhrlk.org. And so if you go to our calendar, all the locations and meeting times and everything are on there. So you can pop on. If we do it via Zoom, then we put the Zoom link on the website as well. But right now everything's in person, like Kay said. So all the meeting locations are available.
And you start out by saying Adam, so if they typed in Adam, though, would that get you to this site through links?
So if you search Atom boards and you go to a Wakaba's webpage, it's got a big map and you can click on Knox County and it'll take you to our website. And you can click on Licking County, either one, it'll take you to our website. But since Atom board is not in our name, it's better to search mental health and recovery.
Yeah, because the local people may not know, they hear Adam more than they do your initials.
Right.
When you speak of budget, how many dollars are you dealing with annual?
So if you so again, there are two different counties, so just take that in mind. Right now, our budget is around 15 million, and if you will, of that, the percentage of levy dollars coming from Knox is probably about 1.25. And I will say this to Knox, the providers up here, our partners up here know how to spend money. And they blow through their levy budget with us really quickly, which is what we want. Right now, our budget is a little inflated because we are the pass-through for a $3 million ARPA grant, which is a state contribution towards building the crisis center that BHP is doing. So that makes our budget look a little bigger than it is, but we would include that as part of our budget. Licking pulls in about 4.5 million, and the rest of our funding comes from state and federal sources. In Knox County, we've been very blessed to have had 2 HRSA grants. And HRSA is a branch of, oh gosh, I can't remember what HRSA is a branch of federally, but it's deals with rural counties. Knox is still considered to be a rural county, and therefore that opened up some additional behavioral health dollars for us, particularly to treat opioids and psychostimulants, which would be meth. And we finished a first round of our opioid dollars. We're in our last year of our psychostimulant. Those 2 grants collectively brought in $1.5 million to help bring in innovative practices. It's why we have an MAT, or a medically assisted treatment program, in the jail that the Freedom Center operates, that we're very proud of, that has worked very well with the sheriff's office historically. It's why we have some of the prevention that we have in the schools through New Directions, something that's called Sources of Strength, which teaches protective factors to children, such as things such as critical thinking, how to make good decisions when faced with adversity, such as if you've got a peer that wants you to drink or use drugs, how to say no to that, and just real basic stuff like that. We are toying with the idea potentially of applying for another additional HRSA grant. These are very, very competitive federal grants, and so Knox has a lot to be proud of that we received 2 of them. I think when we applied, I think the second one, there were maybe 25 grants that were allocated nationwide. So we are very proud to, you have a lot to be proud of, so.
So you have someone at your office that's all they do is seek out grants.
Well, that would be me.
And we thank you for.
Well, you're welcome. And I may have misspoken about the psychostimulant grant. There may not been that few applicants, but it was a very low number.
Yeah.
And I'm thinking more about the new grant that we're potentially thinking of applying for, where there are only 20 opportunities nationwide for it, but I think we may go for it. So anyway, that helps with adding more dollars so that we can provide more services for the county.
Are those grants given based on how badly that area needs it? So, and in essence, are we saying that our area is really bad for those opioid meth addictions?
That's an excellent question, and it's a yes and no question. So we definitely have to show unmet need. An unmet need might be that we already have some services in place. They appear to be working well, but we need more of those services. And therefore having more funding would be helpful to be able to provide even more services to more people. So sometimes we're able to get grants like that if we've already demonstrated success with a particular approach of how to solve a problem. And then we can use that, we call that capacity building, and we can use that capacity to demonstrate success to say, gee, if you would just give us a little bit more money, we could have even greater success to meet our outcomes. So at our board, we are required annually to file with the state of Ohio something that's referred to as our community plan, which is our great big plan as to how we do this work. And our 2 major goals that we work for, the first one is to decrease the level of the suicide rate for each county. And secondly is to decrease the unintentional overdose fatality rate for each county. And there are many different efforts that we use either through prevention, treatment, recovery supports in order to accomplish this. So when we seek additional funds, we stress the fact that we are already using what we would refer to as evidence-based practices that have proven to be successful with that population of people we're seeking more funding for, and that will continue to use that approach and maybe consider using others on top of it.
So there is a suicide line now, right? That
988.
988, yes.
People can call.
That people can call. People can always call 21. This gets confusing to the public, and I'm sorry for this. So 988 is the federal suicide hotline. And if a Knox County resident should call that and wants Knox County services, they will be transferred to 211 here. So that there will always be a way for people to get access to care if they need it.
Okay, good. So 211 would be what we would want Knox County people to. And 211 does more than just a suicide.
Yeah, it does. It's a huge information referral line that helps people get the care that they need. It provides some other community information such as housing. If people need a place to go to a food pantry, it provides them that information. I don't know if you've had a chance yet to speak to Kristen McLeod, but she is the director of 211, and it's a wonderful resource for this community to have. So.
Can you tell me the names of the groups you partner with here in Knox County?
Yeah, Emily, you need to help me. So
It's
ahead.
the Main Place, the Freedom Center, New Directions, Pathways 211, BHP.
What's BHP?
Behavioral Healthcare Partners, they're our largest group in either county. They provide comprehensive behavioral health services, both addiction as well as mental health. They are our crisis workers. We have to dedicate one group to be our 24/7 health officers, crisis workers, and that's what they do. And they're the ones responsible for building the new crisis center in town.
And I assume all these are private?
These are all
businesses?
non-for-profits, yeah.
No, they're not for profits. all of them?
Although there are a couple for-profits that we do have small contracts with. And one would be, and they would be related to some of the services that go through the special docket courts, both at municipal as well as common pleas.
How much money do you spend with the Freedom Center? How much of that allocation would they receive?
Oh, that's a really good question. I will need to get back to you with that.
Of the 1.25?
So again, of the 1.25, there would be other money on top of any levy dollars going into that. So there may be money from other federal sources going, state sources too.
So it's a $14 million budget between Knox and Licking, but 1.25 of it is our part of the budget. Plus the-
Just the levy. Just
Just levy.
levy dollars. And see,
Okay.
this is what this gets confusing. And so probably what would make more sense would be for us to come back on a later date to really spend time with you to show you what our budget looks like. And so that might be more helpful to you.
Mhm.
And if we were to drive on Blackjack Road, what would we see at the building there that they have a foundation in? I haven't been out on
No.
Blackjacks.
I think, the last I heard, they plan to break ground in this March.
Okay.
Um,
And still plan on being done by December, correct?
That's my understanding. I will tell you that the rules of the ARPA grant is that it all has to be done operational by September 2026.
But we're hoping it doesn't take that long for them to.
Oh,
get
we
it up
sure
there.
are. Yes.
You want to talk about the mobile BHP, or is that part of your presentation? that you're
We
gonna do?
can, I think I can give you some idea about what the couple services they have right now are, but I would suggest that you directly talk with them about that.
Okay.
So BHP, recognizing that they provide care to two very rural counties, have a mobile urgent care van. And that is able to go into communities where individuals may have a hard time geographically getting into for services. It provides what we refer to as telehealth. I don't know if with primary care, if you're familiar with telehealth, where you're looking at your doc from a television set. And frankly, in rural counties, sometimes to have enough psychiatric doctor time, we end up using a lot of telehealth. Psychiatry is hard to find. So it offers same-day appointments on the van, and it really works to do outreach. One of the issues that a lot of people identify, particularly in rural areas, is issues with transportation, getting in even to the county seat of Mount Vernon to get services. And so this is a way to take services to them. BHP also has an urgent care program in Mount Vernon, similarly to what physical health urgent care would be. They just extended their hours to have evening hours several nights a week. And they recently extended the age group they serve to serve children ages 5 and above.
And that's out in Blackjack Road.
No, that's not in Blackjack.
That's on Mulberry
It's
Road,
on Mulberry Street.
Mulberry Street, next to where Dr. Ogle's office is.
Oh, okay.
Yeah. So that's intended to give residents of this county immediate access if they need help. So,
So what else would you share with that?
well, I guess the only other thing that I have a very unique relationship with you all, because I am your representative for Knox County for One Ohio, and I currently am chairing your advisory group. So what that means is, and in Licking County, you should know, I was a grants reader for Licking County, and I also sit, I don't know if you had a chance to meet with the Licking County commissioners, but we have similar meetings with them, and they know us well, and I'm assisting Commissioner Bub with his advisory group down there as well. So we have been tasked with advising you about potential ways, if you choose to spend those One Ohio dollars that get awarded to you as a county for Knox County. It does not mean you have to spend the money. You don't have to run out and spend these dollars if you don't choose to. But what our role is to try to give you some thoughts about which direction you might want to do that. And again, if I need to come meet with you another time to talk more specifically about what you would like, that is certainly something that I can do. I think probably this morning there are a couple topics such as our budget and One Ohio that probably take a little bit more time than just, initial, hi, how are you? It's nice to meet you, sort of
Yeah, you
introductory
might
meeting.
mention the new commissioner, what One Ohio is, so they
Oh,
understand.
I'm
what
so
that-
sorry. I'm assuming a lot. I apologize here. So One Ohio are the funds, are the settlement funds as a result of all the lawsuits. And I will send you all information so you know what I'm talking about. How's that?
And it's the lawsuits against the
To
pharmaceutical.
get against the pharmaceutical companies, and it's millions and millions of dollars over an 18-year period of time. The money flows through the One Ohio Foundation, which has this fairly complex group of lots of representation on their board from lots of different sectors and counties, and is directly tied somehow into the governor's office. Alicia Nelson is the director, and I've known Alicia for a long time. I like her very much, but she's the director of the foundation. So the foundation and this process elected to award some of the dollars directly to local communities. And so those awards go out to counties, cities, some places, some trustees, some townships. Depending upon your population, depends upon how much money you get.
Are we currently getting that money?
You're currently getting this money, yes.
We get it through a few streams. We get, Kay mentioned the 18 years, we get basically an annual payment. But then as other settlements take place, that money comes in to the county as well. And I can't remember, you and I talked a few weeks ago about what that balance was in there.
I
can't
don't,
remember.
I'm sorry.
I can get that for you, commissioners. And so that it's sitting in that fund that was specifically set up for this purpose. And at this point, it's building. And that's where Kay's mentioning her committee will then make recommendations on how you could allocate some of those funds within Knox County.
So the foundation there are those dollars. And then there are the One Ohio Foundation dollars that they run their own grants process. And Knox County sits with a number of other counties in Region 18 for the foundation. I am your board, they have a board, I am your Knox board representative. I represent the best interests of this county on that board. And they also run their own process because they have their own set aside pot of dollars. Our region, that we just finished the first round of grant awards, Region 18, I want to say, I don't remember how many of us are in this region. I want to say 14, 15 counties. We had $2.3 million to be able to cover services, which is, I will tell you, as an Adam board director, that is absolutely nothing. You figure I've got a $15 million budget, and I'm struggling to be able to figure out how I'm going to pay for services in 2 counties where my population totals somewhere around 280,000. You start thinking about 2.3 million is absolutely nothing.
It goes fast.
It goes really quickly. So the role that I played for Licking County is I was one of the grants readers. There were a group of experts, of those of us that have done funding and grants reading for years, who sat, there were 7 or 8 of us that came together, and we read all the applications from all the different groups from our region that applied to the foundation. And I spent most of my summer reading those, and
Enjoyment.
well, yeah, it was a real interesting experience. I will tell you that for the counties that we represented, because of conflict of interest, because we're public servants, I did not read applications for Licking or Knox County. I also did not read applications for other ADAM boards or other ADAM boards that applied for funding. I did not feel that was appropriate. I think these dollars are to be used by local entities, particularly those serving families, that lost loved ones to opioids. So, or those that have interventions that are really directed at trying to find a way to address opioid addiction and addiction in the community. So we did that. So, and Lisa Lloyd, who is a program director for Knox County Foundation, is your representative to that group for grants reading. So it's a very confusing, it's a really complex, confusing process. I'll be really honest, and I'm struggling to try to find the simplest way to explain this, and there's no good way of doing this. Other than to say, we're here to serve you. I'm not sure what the advisory group is going to look like. I'm actually meeting with Lisa Lloyd this afternoon to discuss this. There were a lot of participants on this group before. I think that I am very aware of conflict of interest. I do not want to put you all in a bad place about who makes what decisions and such. And so we may advise that the membership of what we think should be sitting on that group. So there's no concern about conflict on your part whatsoever. So.
Well, I know when this all was all coming down and everyone was like, yes, we're gonna get all these dollars to be able to help out Knox County and we'll be able to do all these things. And then it was like, oh, well, it's gonna take 18 years to get your money and it's gonna have to jump through these hoops to get this money. And it's just, the excitement just really got watered down real quick.
Well, so I will tell you, both being a funder and someone who's applied for funding for a very, very long time. In the past, probably 5 years, there's been a new requirement, and that is you must have a sustainability plan of how you're going to continue the approach following the end of the grant period. So quite frankly, I wouldn't be applying for a new funding source if I had that money to begin with. So how am I going to come up with a sustainability plan to cover, that I don't have? So there's some holes here in terms of how to figure it out. And I laugh because a lot of the applications that I became aware of were using sources that I knew did not have funding that they were going to be able to assist them with. But I can't say I blame them for trying. So it's all okay. Yeah. And any other, I'm sure what I'm saying is just as clear as mud at this point. Any other things you're curious about or questions you may have for us you can think of?
Well, if you were to do your elevator speech to the people in Knox County about the benefits of your program.
Yeah.
What would you say to the Knox County people as to, your levy dollars are doing this and that's
Sure.
a valuable thing?
So we are your safety net. We are probably the best kept secret in this county. Very few people know who we are until they need us, until they're in crisis. And so the one service that we do pay for, that most people are not necessarily aware of, is many people seeking treatment in all of our agencies receive Medicaid. So they don't have to worry about paying for care. But if I'm someone who works and my insurance doesn't have a good copay, or I can't even afford my insurance, if you or your family need to be in counseling and need help, levy dollars help pay for that. And that would go not only for outpatient services or counseling that people receive in the community, but that it would also go if you need to be hospitalized for a psychiatric reason, or if you had a drug and alcohol reason and needed to be in a higher level of care. We do have programs and services that we fund. We would like to do more, but we do what we're able to do. And so I think that's the value we bring to families in the county, is that we are the safety net and we are here to serve them. And we do listen carefully to what families and others say to us. Voice and choice, I would refer to it as voice and choice, for us is really important. We are just finishing a a comprehensive behavioral health community survey for both counties. We're running it out of an organization called Illuminology, using interns from the Ohio State School of Public Health. And we're really wanting to know what the general public thinks that they want and what they need. And what they're suggesting to us is they want more outpatient counseling, they want more accessibility to prevention. And so we listen very carefully to what people say. So that's what I would say.
Okay.
We're here to serve you. That's our call goal. We're here to serve the county, to the best of our ability.
What type of things do you do for prevention?
So for prevention, we would, for children and youth, we would do school-based prevention that we would refer to as universal prevention. And that is that we do provide certified prevention specialists who do go in the schools. And again, probably one group to be very aware of is New Directions, who did receive the One Ohio Foundation grant from the foundation here, which for their sources of strength, which is what we would refer to as an evidence-based service provided in the schools. They're currently working in Centerburg, and they have a really good program going forward. And what that, again, that prevention teaches children are what we refer to as protective factors. And those are things that if you're parents, that you want your kids to know, which is how to make a good decision, how to have empathy towards others, how to critically think, how to take care of yourself if you are in a place where you have to make a difficult decision, so you learn how to make the right decision. That's what we think good prevention does, teaches kids which are life skills, and helps really, support, what kids are learning at home already.
Does this co-work with detox or no? Because I've heard the word detox in a couple of our meetings, but it
Yes.
seems like nobody really has the answer for someone to go to detox if
Well,
they need it immediately.
we have that answer. So if someone needs detox services, in Knox County, they would contact the Freedom Center and talk to Offit Clinch, who could assist people in accessing detox. Offit is our front door for detox services up here. In order to get into detox services, it gets kind of complicated. But you have to have a special medical clearance called an ASAM assessment that tells us what level of care that you need. Offit would then refer people to that level of care. We at the board do what a pre-authorization similarly to what you might have in physical health care. And so we do our very best to get people to detoxification services as quickly as possible. The other way people can gain access to detoxification services right now is to present at Knox Community Hospital and to request support there. They will help them get connected to detoxification services. If a resident has problems, they can call the board, and we will assist them if we're able to try to find them services. In Licking County, we have Shepherd Hill Hospital that we have a contract with that also serves Knox County residents, that does all level detoxification services.
Let me take
And,
this.
and, and,
take
and that
this
helps
to-
people with withdrawal.
Yeah.
Yeah, and that's what the detox is, withdrawal. That's,
Right.
I'm on a substance, I want to get off,
Right.
but if I get off, I'm going to have bad symptoms, and in some cases, it may actually kill you.
So there's a process to get that.
Yeah.
So what happens if law enforcement on either channel shows up to an incident and the person is addicted to some type of substance? And they say, I want to go to detox, I want to go immediately. Is there a service for that, or they have to go through?
It depends upon the time of day. So law enforcement cannot take them directly. So in order for there to be an admission into detox, again, there has to be medical necessity. So they would either have to contact right now the Freedom Center, or they'd have to contact the hospital to use our dollars, is what would have to occur. With the crisis center eventually coming in, what we're hoping is that will also help with that process.
So there's no age factor or anything like that that goes into this detox program?
No.
Okay.
Although it's very unusual to see a child under the age of 12.
Right.
Yeah, it does happen, but it's rare.
Are you able to provide us with the services that you're right now funding in Knox County?
I would be
and
happy
any
to, yes.
success or rates, so we can look at and evaluate how the money's being spent, how these services are operating. You hear different things about, bartering with jail sentence versus going to a detox program. And I just like to see the results of those programs and how we're spending the money and how effective it is and how much ground we're making for the future.
Absolutely, and I think it's a great request. Give us a little time. We need to get the results of the community assessment in, and then I need to get some results from collecting data from some of our providers. So it's some of the information we collect. Some of the other processes you're talking about are outside of what my authority is, but let me see what we can do to pull together a clear picture for you.
Sure, we just want to see our residents free from drug addictions and
Yes,
having
Yeah.
strong families and fulfilling their purpose, right? Not in
absolutely.
and out of programs and some of those programs don't seem to have the success rate you'd like to see, right?
So let me share this one bit with you, and
Sure.
this is always a struggle for me. We know nationally and we know historically that with addiction treatment, for some people, it takes up to 7 times, if not more, before they're able to find their road to recovery and eventual sobriety. Takes them some time. We, hand in hand with that, we know that 50% of people that start engaging in programs don't finish, which is why we do so much outreach and engagement to say, okay, fine, you dropped out. Well, we want you to come back now. So let's see how we can get you back in. We do an awful lot of outreach and engagement. And if you talk to off at Clench and you listen to some of the programs at the Freedom Center, they have a whole slew of outreach programs that they try to keep people engaged. And then when they kind of fall away, try to figure out how to get them back in. That's a big part of what we do, particularly in addiction. To treat mental health is a lot different than to treat addiction. Whole different set of rules, and how we get people engaged in care, but you're absolutely right. And we'll see what we can give you then.
That would be great. Thank you. so much.
Absolutely. Thank you.
Do you have like a brochure or flyer that the community has access to?
Not currently. The best way to find information is on our website.
Okay,
Um,
but I'm thinking like people could walk into this building all day and we have a table out there with all kinds of literature.
That's
and
a great idea.
It'd be nice because, you know, it's, as you were talking, you say, contact us. Well, they don't have a hard copy. And they may not know how to, and then some people don't have the computer access.
So one thing we can do is I can leave some cards, business cards with our contact information on it. But the important thing to remember is that at the board, we don't provide services. And
Okay.
so if people are wanting services, they're gonna need to contact the providers. So what I can do is I can get brochures from the providers for people who are looking for direct services. And then leave contact information for us if they have additional questions. I think that would be the easiest
Okay.
way.
Does
to do
someone
that.
have a flyer that has all those agencies in there? Says we do this and we do that.
No, but we could make one.
Okay, I think that would be
Mhm.
helpful.
Actually,
have
I've
it one
spoken
spot.
with people that are running different services and they wish there was someone brokering and making everybody aware
I
of
mean,
what they are.
well,
We do have a resource card.
Yeah, we do. And I'm thinking, yeah, we do have a very comprehensive resource card to answer your question. And we don't have any with us, and I apologize for that. But we'll make sure that you have a bunch of them, but it's specific to Knox County. It has all this information in it.
Right. I
And
thought
it's
I'd seen-
and it's a trifold card. And the reason it was trifold is we developed it for law enforcement for our CIT officers, and they would tuck the cards in their top pockets and pull it out when they were giving resources to people in the community when they were working with
That'd be
them.
good.
Yeah.
And that has our
so-
phone number and 211's number on it, 988, and all the providers that we have.
Yeah, I think it's been 3 or 4 years since I've seen that, and I didn't, you know, I knew there'd be
Yeah.
some updates.
Yeah, I'll run some of those up.
Yeah, well, we keep it updated all the time. So to answer your question, yes, we do have something. Yes.
And just so I'm clear, Adam, I'm on your website, it is a governor's program for Ohio. It's not a federal program, or it is a federal too?
So our program, no, we are not federal. So we are a state mandate. county program. We, because we have more than one county, we are our own taxation district. If we were a single county board, we would not be our own taxation district, but because we are our own taxation district. We have our own board of directors. All Adam boards do, but we have a board of directors, and we do not use the prosecutor for either county. We have our own counsel, and that there's some distinguishing factors. And so when I go to do a contract with a provider or anyone, I do not have to run it through the county prosecutor. We have a legal firm that has is an expert in understanding the law surrounding what Adam boards may or may not do that we use in Cleveland. So there's some distinguishing aspects to that, but we are definitely a county organization.
So you would be the one that makes the decision how or where services are fulfilled at? So I guess we toured Job and Family Services, and they were sharing with us about someone who'd been sent out of state.
Oh, no, I
You
don't make,
do that.
I don't make those decisions. No,
Okay.
that's so, and I'm sure it's gonna take some time to sort this out, because there are points, I will be honest with you, we all may come together and make joint decisions or have joint conversations, but it would be JFS that would make that final decision about what would happen to a child.
You would consult with them about,
Possibly so, yes.
Services.
Yeah, possibly so, yes. But that's part of the strength of the partnerships in this county is we have really good working relationships with other parts of county government and other parts of local government as well. So yeah.
Good question.
It's a very good question. It's gonna,
to
yeah.
help people, we have to understand how it operates. And
Yeah,
sometimes
I-
bureaucracy actually complicates any answers, and you just keep spending money and it goes in a circle. And honestly, if I'm a for-profit
Yeah,
and I am offering addiction services, you understand the point is that addiction service, unless there's addicts, I'm not making money. And so it almost
absolutely
seems,
true.
it seems like a circle that doesn't solve itself because it doesn't need to solve itself if you want
Yeah.
to stay in business.
Yeah, so I do think we do see a lot of success stories. And I think probably in some of our grants reporting, we can share with you some of those success stories. So they do happen, and we are very excited about that. And I think that's why we never give up. We never say no, 3 strikes and you're out, you can't come back. We go back and we go back. So we are really good nags. So I'm a professional nag. So just think of me in this way, that we are all professional nags, and we find ways that we try our very best, understanding that people have to control their own lives, that it's their life. But boy, we would prefer you might do something a little bit different with it, not for us and our lives, but because it would make things so much better for you.
Sure.
So
It's clear there's a mental health crisis, but I think that some of the bureaucracies create some of the problems, right? And so we have to figure
Yes.
out how do we.
yes, I could not agree with you more. Yeah, it does. And so we work really hard, which is why we try so hard to be transparent. And we would invite you to come to our board meeting anytime you like. I would be happy to explain what happens. Most of our decisions happen in committee, where my board members are very involved. They really like to get down and they like to make decisions and they want to know. And some of the questions you're asking, they ask of us all the time. So I want you to know that those people appointed to our board really care about what happens to this county.
So could you email us your board meetings, where they're with the time and
I
where they
will.
are?
I can do a couple things. Not only can I do that, I can start sharing with you, if it would be helpful, our agendas and our attachments. If you'd like to see the nuts and bolts of what we do, we would be happy to provide all that to you too.
That'd be great, yeah.
Yeah, so you can begin to understand who we are. We are trying really hard not to be complicated, but unfortunately, because of the way statute goes and how things go, sometimes it gets complicated.
Really appreciate your work. I just trying to figure out and understand all the
That's
pieces
fine.
and parts, because to me, this is almost number one thing that we have to tackle in Knox County. I think that it really is what costs us a lot of funding, money, hurt lives, kids, families, brokenness. And so if we could tackle this, I think that we would be a much more prosperous community, and our constituents, residents would have a better life, and that's what we want, right?
Absolutely.
Especially for children.
I would absolutely agree, and I truly appreciate your support, all of your support in this.
Appreciate
That
it.
really helps make our job a whole lot easier.
Okay.
It really does. I appreciate that. So we will try to get to you as we get it done, some reporting, so you have an idea as to where we stand on some things, and we'll kind of go from there.
Yes.
We appreciate it.
Thank you. Well, I'm very grateful for your time this morning. And again, please feel free to call Emily or myself. I know that we don't intend to be confusing, but we would be more than happy to help explain anything you would like to better understand. And again, I guess Jason, you and I will be talking about One Ohio again and about what we're going to do. And I will say in Licking County, they have used their One Ohio dollars for one project, and that's for the health department, and that's for a community navigator. And that navigator's sole job is to assist families in finding access to detoxification services and other crisis supports. And when we did listening sessions, Commissioner Bub and myself did listening sessions in Licking County to find out from the public how they wanted their One Ohio dollars used. Families that had lost children, adult children to addiction said, at the time when we were in crisis, if we could have had someone to help us figure out what to do, that would have meant everything to us. And so then the commissioners made a decision to go ahead and fund this one position. And they are kind of taking their time too with their dollars to try to figure out what's the best usage of money. So just to let you know. You're welcome. Thank you very, very much.
Pleasure meeting you.
It's a pleasure meeting you too. Very much a pleasure.
All right, we will get out of the way so JT can come in. I know it.
Look forward to seeing some of those reports. So
Yeah,
finance
just
results.
give us a little time. They're gonna come in slowly between now and probably the end of June. So,
Wow, that long.
well, it takes some time to figure out, but I can give you some preliminary information. Probably from the HRSA grant, but we're reporting some of our success with the HRSA grant. I can begin to give you some other information.
And when will we need to make decisions on how some of this money's allocated? and what-
You don't.
You don't, we don't.
You don't. Our board does.
Okay.
So we're happy to share with you what we do and you can have a better understanding, but the board does.
Okay,
Okay,
all right, thank you.
thank you.
Thank you. Okay.
Board member is in recovery. Is he or she from Knox and mention?
Darn.
Well, yeah, I'm searching for one from Knox County that's,
So what are you looking for?
it can be a couple of different facets, but basically someone in recovery who is, has an inspirational story that's,
Talk to off at Clinch and see what she can't do to help you. Okay, I know we have them, we've reported on them, she would be your best bet for that. So JT doesn't know this yet, but we got the behavioral health disaster grant from the state of Ohio, where we are being charged with taking the lead to developing a behavioral health preparedness disaster plan for both counties, which directly involves him. I haven't told him we got the money yet, so.
A behavioral
A behavioral health preparedness,
disaster.
yeah, disaster plan. So if you will, when someone goes through a disaster, so for us, with our services, we'd have to find a way to continue services. Say, God forbid, Mount Vernon got leveled by a tornado and all our buildings were gone. So then we would still have to serve people that would have issues with addiction as well as mental health. How would we do that without having that building stand? And then the other part of the disaster planning is looking overall, then how do you respond to the general population who obviously is going to have experienced trauma and loss? And disaster counseling is very different than crisis counseling. So it's a whole different experience. And
So
so
that's a grant from the state?
it's a grant from the state that we are doing this.
And do you work with any faith-based organizations, or do people have that choice to work with a faith-based organization
They
if they desire?
absolutely do, and we do. We work very closely with Touchpoint here in town.
Right.
I'm a big fan of Touchpoint, and absolutely. We've also worked very closely with a man by the name of Pastor Greg Delaney, who is someone who is I know met with a group of pastors to talk about prevention in churches and recovery in churches, so. Yeah, there are lots of connections,
Yeah,
and I'd be happy to talk to you more about
my
that.
experience is that component actually helps people stay in programs. You're talking about the longevity, fulfilling
For some
them.
people, yes, I would absolutely agree, which is why we had Pastor Delaney come down and speak, absolutely.
Thank you.
Okay, that current balance in Knox County is 353,000 in one Ohio. That's our.
Oh. Okay, that's some money.
Yeah, so,
Okay.
yeah,
Again, you're not obligated to spend it. We will just give you some suggestions about,
It's not use it or lose it.
no, it's your
those
money,
are our funds.
it's
so-
your money. I can't stress that enough. It's your money. You make the decisions about how you want
So
to
it can be
spend.
prevention, it can be whatever.
Yes.
Instead of putting, I guess, pharma's money back into pharma, we can actually use it for prevention. if we
That's the
decide.
idea.
Yeah.
And you can decide what you want to do with it. And I'll give you some recommendations based on some of our outcome stuff and some of our community service stuff, and we'll go from there.
Thank you so much.
You're welcome. Thank you.
Thank you.
Thank
Thank you.
you.
Take care. Good day. See you. Hey, good morning. We got our grant. We got.
He has it, so.
Andrew, other come, you want to grab him?
Yeah, this is something a little bit different. I'll send you our opinion. And the grant that we wrote.
I'm not sure.
See ya.
Good morning.
Good morning.
Warmer than I was yesterday.
So we have JT DeShant and Amy Stewart from the Knox County Emergency Management Agency here with us to give their report. Thank you for being here. We are live streaming, so make sure that before you get in here to have your hair combed and
I was looking for the makeup room.
yeah, it's closed down right now for remodeling.
Okay.
Ran out of capital funds for that. So, yes, go ahead, Chief.
All right, so first of all, we'll go over the presentations we have completed. I did a weather safety and preparedness for the Knox County Safety Council. That's that subgroup that's under the Chamber of Commerce. We did some updates on just, different things throughout the winter, what hazards are there and, how to mitigate issues before they happen. We're working with National Weather Service Cleveland right now to pilot a program for weather awareness and reporting for dispatchers. We've had some interest with our dispatchers wanting to take our Skywarn training that we put on. And that goes a long way with the phone calls that they receive from people during weather events to know what kinds of questions to ask, to decide what kind of cloud are they really looking at. Are they seeing a tornado or are they seeing something else? So they're a little more educated when it comes to reporting that to the weather service, knowing what the weather service wants to hear from them, the questions they're going to ask, so they can be better prepared and get warnings sent out earlier. So that, like I said, that's a new program, NWS Cleveland starting and piloting here with us. We also sat on a virtual call with Crawford County EMA and their school resource officers. They don't have a county reunification plan for their schools. And when the SROs started to get together and talk, they realized everybody's doing something a little bit different and they didn't really know how to get this off the ground. And our counterpart EMA director in Crawford has been down here, visited ours, been through the process, heard everything about it, asked good questions. And she said, why are we reinventing the wheel? We can go to Knox County, learn from them how they got started. So that was good for us to hear what kind of questions people are asking too that don't know. 4 and 5 year processes, sometimes you forget where you started, right? You kind of got to go back and look, and without talking through with someone that's totally unaware, you forget about those little things that you picked up along the way,
So
so.
what's the main city in Crawford County?
Bucyrus.
Okay.
And their school population is about same as what ours are, so.
Yeah, and they're all kind of cluster located. They're all within 10 or 12 miles. They're looking at, maybe we don't have a building per se that's big enough, like we were fortunate to have an energy field house that we can do this. But they're looking at, can we have sister schools? So if it's our school that's affected, can we go to yours and you to ours and still use the same people? Have one team from all the districts, kind of like, we've set up, so. We had a exercise with the Healthcare Coalition. I'll let Amy kind of expand on that in a minute. The health department came wanting some help getting the tabletop exercise off the ground. It was a chemical surge. And Amy and I discussed and said, what a great time to kill two birds with one stone. Because we had to do a local emergency planning commission, LAPC exercise to have evaluated by the state. So let's write one around both. So we actually had our state CERC representative from Ohio EMA there, and he did the evaluation on the LAPC portion of that. And Healthcare Coalition got what they needed out of it, and Health Department. And you can kind of discuss what it was.
So basically we had a chlorine crash in Mount Vernon. And so we had the fire department, the health department, hospital, us, and the school, because we did it, our last objective for our LEPC was sheltering. And so we were able to utilize our school reunification location as our shelter, because the school is going to be affected from the chlorine spill. And who was our last group? It was just you and Rick that sat together.
Yeah.
That's right. So so
I say she helped develop.
Oh.
They kept me in the dark so I could play.
well, yes. So Suzanne Dapperich and I Suzanne from the health department and myself from EMA, we were the co-facilitators for the exercise. And like JT said, that we were able to do both the LEPC, our obligation for exercise for that, and then the health department for their grant. So of course we had it on one of the snowiest mornings, but it was all good. So everyone thoroughly enjoyed it, because whenever we can get together and exercise and talk plans and talk what those steps are and those response, the better off that we will be in the future if we have to ever use those plans.
So, Mary Drenda, so you guys understand Bill's heard this over the years. With our state evaluator being there, he writes up a report afterwards showing what capabilities we were attempting to achieve, how we achieved those, what points, good points, bad points, things like that. That's presented to the State Emergency Response Commission. They will vote to concur or not with his findings, whether we passed or not.
Is
So
that the report that you sent over with the percentages of, or is that a different report? JT?
I sent so many things out, Barry.
I got one that showed the hospital, in like, where they
That was their own evaluation.
Hospitals,
Yeah, at the
yeah.
hospital, yes. They had to share it out with local community groups, and so Dan was like, I just put it on Basecamp and then
Yeah,
let
sure.
everyone see it. So
And then Suzanne on her end of things with Healthcare Coalition.
well, that's
She
for the
was-
health department, not the coalition.
Well, they were on the regional
Oh,
Healthcare Coalition had a group that was virtual. So after we do a portion of the exercise, she'd go off for a little bit and kind of report out to what we were doing. So it wasn't just Knox County that day. It was,
It was a
everybody in the
regional.
region.
and then now that we have done our LEPC exercise, the next exercise cycle will start in July 1st of 25. And so we'll have from July 1st until June 30th of 26 to complete our next exercise. So we have to do a hazmat related exercise every year. So it can be a tabletop, it can be a full scale or a functional, so.
Yep, and that completed that year's, or that exercise cycle, so we kind of
So
started.
what
over,
happens if
excuse
we
what we-
fail?
Never has happened.
Are you aware of others that have
I've
not?
never heard one that's failed,
Okay.
so.
Probably don't stand in position.
Well, in that's basically what you're looking for. You're looking for failures. Because that's how you test that plan, right? What capabilities, we say we can do this, but if we can't, how do we mitigate those? So it's not that you fail the exercise, you may fail part of that plan, but that's okay because you go through that exercise and that exercise and training cycle and you realize, hey, maybe our first responders don't know about this new equipment that we have. So what's our mitigation? We're gonna buy that equipment that they need with grant funding or however we can get it, or we're gonna train those people. That's why that every other year training cycle we've been on with LAPC funding goes to our first responders or, you know, we're doing the hazmat IQ training, what is it, first five above and below the line, all those
Yeah.
trainings we provide the fire department with. You know, we don't have a typed hazmat team within the county. It's a line of sight rescue, so we don't train above what their abilities are. They know if it gets that bad, we're calling mutual aid. You know, it'll be Ashland County, Franklin County with their hazmat team, so.
Good.
So it's a learning process. That's
Oh,
what
yeah.
it's about, right?
Yeah, yeah.
Right.
Education committee, Amy and I are both on the Emergency Management Agency of Ohio, or Ohio Education Committee. So we have in April, the spring conference coming up. It's 2-day conference we share with the state EMA conference. We're also looking at the fall conference, that's usually virtual and already planning presentations and things for the winter conference, which is at Salt Fork. So we always try to, especially when we're sharing with the state, we try to pick a different topic than they're going to pick, and sometimes they're a little bit slow on telling us what it is. So I said, you know what, this year we're going to tell them what we're doing and let them pick around us, because I'm tired of kind of waiting until the last minute to decide what our topics are going to be. So. Amy helped with that chemical surge tabletop. We did, Amy and Rick and I met after, our school reunification, planning group met, did a after action, and then Amy and Rick and I met one last time, kind of went over and.
And Rick is.
Rick Schaefer
Okay,
from Mount Vernon City
okay.
Schools. And we finalized that after action from our last exercise. I'm actually had it pulled up today, getting through the black and white and getting that reunification plan finalized. So, and the exercise that we did, we had different positions that we realized after the first evolution of that exercise, talking about how that works, it wasn't working. You know, we had the people called the wranglers, we had the people called the matchmakers, and they weren't real sure why we're trading people, family members off to somebody else. So that second evolution, they said, you know what, let's do away with that matchmaker spot and let the wrangler take that person from start to finish. So that's one common face they have through the whole process. They kind of figured that out on their own. Well, that worked best, you know, after we kind of sat back and discussed it. So that's something that in writing this plan, we're going to change. There'll still be a matchmaking process, but that's going to be on the school staff that are with the students that, you know, come from the affected schools. So
would there be an issue whether you have enough wranglers to do that?
no,
We
we're
haven't-
90+ people on the team now
Okay.
with all the districts, and we've gained Highland, from Mara County, Utica. There's talks with Richland County, maybe not so much joining the team, but getting us to kind of help them get something set up too for their area, because there again, they share students with us at the Career Center and things like that. So, and with Highland, you know, that's in a run district for Eastern Knox County Joint Fire District.
No.
So, or I'm sorry, Central
Centerburg.
Ohio Joint Fire District. Was easier when they called them Centerburg.
Right.
You know, it only makes sense. So.
So you feel confident our schools are secure and that we're ready if there was any kind of a threat to any of the schools?
I think in Knox County, we're ahead of the curve on that.
Great.
With the rescue task force training, with the situational awareness sharing that goes on with our SROs, we're definitely ahead of the curve. You know, we had the school shooting yesterday. Soon as somebody heard about it, they're on the chat and we're discussing it, and that's something we will, once it's over and done with, we'll get that after action report that's done and we comb through that and
We didn't have the
they?
shooting.
No.
Tennessee had
I'm
it.
sorry, we never, I'm sorry. I don't- If it happens in our, on our soil,
Sorry.
yeah.
Tennessee had it.
Well, I automatically started thinking, was it Nashville? Ohio?
Yes.
No.
Yeah. No, but we as a country
Sure.
own that.
Sure, we do, absolutely.
It's a sad reality, but
Mhm.
we've done so much to try to fortify things best we can, and there's always those holes, the what's and ifs,
Sure.
and they probably get sick of Amy and I playing the what if game all the time, but
No, it's
You
good.
probably looked at the Uvalde shooting.
oh yeah,
Over and over.
Oh,
because
over and
that
over.
To me was a disaster.
so you weren't here for that. We realized after reading the AR, how long it took them to get forcible entry tools in.
Right.
I went to the Community Foundation, got a grant to buy forcible entry tools, put in every cruiser in the county. How are we gonna fix this?
Right.
That was an easy way for me to do that,
That's
so.
great, JT. That's where you have to be proactive, because in those situations, you don't have time to go back and.
No,
If you procrastinated or you haven't planned, you plan to fail.
well, but, you know, you look at how that has evolved over the years. It was the quad. We were all taught, you know, wait till you get 4 guys there. It's gotta be 4 guys to go in. And then it became, well, we're waiting on SWAT. And then we see those fail where kids are dying inside for 30 minutes waiting for SWAT to get there. We can't do it that way. Then we went to, you know, a 2-man team, and now it's single shooter confrontation. You just have to. And as things develop, and obviously you learn from others' mistakes, you try to do better, so.
Well, and I'll jump to, we attended a training through our international emergency management um association, and it was about K-12 reunification strategies. And we're proud to say that we didn't really learn anything new, because
Yeah.
exactly like what
Good
they
deal.
talked about
You were
is
right.
exactly what we go through, and or what we have planned. And the folks who ran this and that was on the they had a panel. It was a gentleman out of Texas, from Dallas, and it was a school that has over 100,000 students. Like, it's just mind blowing how large these school districts are in Texas. And then the other one was out of Houston, about the same size. And then there was a lady from Florida that had about 8,000 students in her school district. And then there was a lady that was out of Arizona that was part of their children's hospital. And so pretty much what they talked about was everything that we're doing in a significantly smaller school district in a county. And so like I was super excited that we didn't really learn anything new, because it was stuff that we've already done. So
Yeah.
uh,
And their campus is so large, they were doing on-site reunification. They didn't even have to leave their campus because it was so large.
or they were using other school district owned property.
Yeah.
Like the one that we looked up, that I forget what the facility was called, but it was like if you walked
Barrett
into
Center.
Berry Center, and if Google it, and it's just like it would look like you're walking on to OSU's campus. I mean, like, and it's a county, you know, it's a school district. So I mean, like, they have these large facilities that they can do those either on site or being able to bus them to another facility owned location. And which, you know, they were talking to that they still have a 20-minute bus ride if they're going to another owned property. So it's the same stuff that we're facing here in our county. But we're just fortunate that all of our school districts are working together to do that. So I just wanted to,
Well, since you're pointing out sizes, so what size is Mount Vernon's school population?
4,300,
Say 4,300?
somewhere about 4,000, yeah.
Okay,
And then the other school districts are 1,200 and less. So, you know,
Those
like,
are intricacies that we had to think about,
mhm.
you know. We were doing, you know, our walkthrough and our plan one way because we were thinking about one building, and then we get Fredericktown on board and realize K-12 is under one roof. You can't build a quick wall and say, okay, only this half of the building. No, you're evacuating everyone. the way we were doing it wasn't going to be efficient, so we changed that layout based on that, and it works better for everybody. And so those are the little things as you do, you know, the practices and the walkthroughs that you learn, so. We've been working, trying to get a meeting put together with, some regional emergency management agencies, for our CERT team. It's a community emergency response team. They're volunteer individuals that go through specialized training that we can call for traffic control assistance, running errands, feeding people, things like that. Our CERT coordinator, moved out of the area several months ago. We didn't really have anybody within that group that was willing to kind of step up and take over right now. We're tasked with enough right now that we don't either, but we still want to have that. We're finding out that Richland, Marion, Morrow, Ashland County are kind of all in that same boat. So we're trying to meet together to come up with a regional team. So we can bring everybody from those counties into one team and they can break them up into what are their abilities. So if it's traffic, we're not putting, you know, somebody that's in their late 80s out on 13 directed traffic, right? We want to suit people where their abilities are. So working through trying to with sicknesses and trainings and things this year, it's just, I think we tried in December, we've tried twice in January to get the group together, but that's something we are working on. Update on the grants, the Building Resilient Infrastructure Communities Grant, BRIC grant, that's for our hazard mitigation update. That's a 5-year cycle, so every 5 years we have to update the plan, every year we have to review it. Federal government puts that BRIC grant out, and we have to apply for that. I am hiring a consultant. And you folks will see the contract once that's done. It's passed legal through CHIP. It's back in a consultant's hands. It's Resource Solutions out of Norwalk. A lady by the name of Sandy Hovest. Sandy's done our review for several years, so she's very familiar with what our plan looks like. So she will facilitate the group meetings with partners, our community meetings to kind of get that input on what our hazards are. Federal share on that, you'll see it's 75%, the local share 25%. And I did the in-kind application for that. So I will get a dollar amount per hour for each person that attends those meetings for me. And that was $8,500. And I think when I put the application in, you had to break people into groups who you would invite. And I was like 18,000 rough figure. So if I get half of the people to show up to the meetings, we're going to be okay with that. So, like I said, that contract's being finalized now with Sandy, and when she mails me the original, get Chip to sign it and then bring it to you folks. EMPG supplemental grant. So at the end of the third quarter, we had expended all of our EMPG funding. They picked up a little bit in fourth quarter, but not a lot. So obviously, if there's money left on the table, they throw it back in the pot. They offer this supplemental. So anything from October, November, December last year that didn't get paid out, I'll be able to resubmit for that through a cash request. That's where I take all the receipts for everything. We go over our benefits and insurance, and I submit those either under personnel costs or under operational costs, and we get that money reimbursed. And then first quarter 25, January, February, March, I'll be able to claim in April, and we'll be starting back in zero that way. So. Continuing education, I finished my last class in the advanced professional series, submitted that to the state EMA, and got my certificate for the advanced professional series. So that is done for me. Take a little hiatus on training maybe now and work on some things. Those are mandated classes for emergency management directors. You have 3 years after appointment as director to get those things done. So I moved through that in about 1.5 years. So
Goes online training or in person?
so you have your prerequisites. Some of those were online classes that I had to have. And then there's a list of 15 to 20 that you can choose a la carte. Those are all, you have to have 5 of those. Those are all in person. So, and usually those are 2 and 3 day classes, not just one and done. So And they're, you know, higher level trainings, mass care, mass evacuation, things like that.
So now Mount Vernon Nazarene University has a program,
Mhm.
right? So were you able to go to any of their classes to
No.
get that certification?
Now, there are FEMA classes that I went to.
Okay.
And then I did an online training, First Amendment auditing. That's kind of been a hot topic, obviously, around the country and, you can look on YouTube every day on people that, you know, come in and, you know, they're making sure everybody's doing everything right, right? We talk about transparency, but when it comes to making sure everyone at every level understands what that is, if they're standing out on the public sidewalk with a cell phone and taking pictures inside, they're allowed to do that. You get in trouble when you send that officer out there to say, no, you can't, and they end up in handcuffs and things like that. So that was some awareness training that I took, and several of the deputies got through that too, when I pushed it out, I think, to the health department. It seems like, you know, your business offices within in the counties and cities are the ones that are getting hit with the auditing, so.
So I graduated from Leadership Knox in October, and then I am on the steering committee to be a co-facilitator, and so I was able to get the government day, which we will be doing in July, and so I will be reaching out soon when I talk with my co-facilitator to see exactly what we want to do. I'll be reaching out most likely for you guys to be able to speak to our class. I think this year they have around 32 that's going through Leadership Knox. We already talked about the crisis within the crisis of K-12 unification strategies. And then I also on Tuesday did a virtual training about school transportation safety. Rick Schaefer actually was part of the panel of discussion. And then there was a gentleman from Pennsylvania, and I forget where the other guy was from, but they were significantly larger school districts than what we have. And so they were talking about the different safety measures that they provide while on the bus for students. So that was pretty interesting, but as we all know, technology costs lots of money. So you know, I don't know what our districts will be doing in the near future, but it was just interesting to see what the ones are, how they're utilizing the technology in other districts. So that is, oh, and then I attend the monthly safety council meetings. And then we've had numerous weather service briefings, either sent to us or we've attended them. And we're part of the mobility management TAC meeting. So we had our quarterly meeting this month.
And then the bi-monthly law enforcement chiefs meetings, had that yesterday. We do, also attend the Fire Chiefs Association meetings. Those are quarterly. With the weather, okay, go ahead.
Where did the chiefs meet?
Fire chiefs,
Yes.
Mount Vernon Fire, yeah. And LE chiefs meetings at the sheriff's office in REOC. Speaking of weather, we had 4 phone calls or emails. Over the last several days because of the cold weather, questions about whether we were going to open up a warming station. I had a discussion with Zach Green at the health department. We back up a week before when we knew this was coming. Amy sent out an email to our partners. We're not activating these, but if you're going to be open, let us know. And crickets. But we understand cold weather. Some are volunteers, some are older volunteers. They don't want to be out in the weather either. But we got to a point, there was enough chatter that we thought we should do something. So we coupled with the health department, and they opened yesterday, 8 to 4:30. And as of 2:30 yesterday afternoon, they hadn't had one single person show up.
And where was this? Was it at the health?
Out the health department's
Here,
conference
not
room.
downtown.
Yes,
Okay.
that's where they had the available staff and space. So that's always a hot topic. But we also realize what happens when you do that. You know, some places are tasking somebody with other duties to sit and watch and monitor those, and then nobody shows up. What do you do? But
Do you think the location had anything to do with it, JT?
I think it could
Yeah.
have. But I also look at the fact that if I'm that cold, I'm gonna find
Yeah,
a way
you'll
to
find
get
a way to
there.
get warm, yeah,
Yeah.
as
Um,
long as you're capable of thinking.
Yeah.
But
Yeah.
So how was that communicated to the public that was open?
Knox Public Health, produced something for their Facebook page. We shared it. City of Mount Vernon shared it.
And you shared it on Facebook?
Yes.
Okay.
Yeah. And I
It's
don't
kinda
know,
tough to
I don't
get
know
out
who
there.
the health department shared it with,
Right.
whether they did a press release or not.
So did it get on the radio then?
I
WVLA?
don't listen to local radio usually.
Okay.
I like older stuff, unfortunately. They don't play Sinatra for me.
Yeah, yeah, well, I was just curious as to how the general public, who may not, if they're needing a place to heat, get warmed up. They probably don't have access to any of this other information. Just curious.
Do we don't really have like a policy of this is what we do when the temperatures are this, and this is where we meet, and this is how so it's like a standard that we know about? Or you don't think we really need that?
Amy and I had just in the last 2 days discussed maybe a warming center or cooling center task force. Licking County does that. And they kind of have that group that will meet and make those decisions. We've kind of kicked that idea around whether we do that or not.
Yeah, it could go both.
Because we're gonna be
Yeah.
facing this in another 6 months when
Well,
January or June and it's 95 degree, that first, that hot spell at 95 degrees. And do we need to open cooling stations? Don't we need to open them? So it's such a touchy and tough subject of what do we do? And that's when we've also talked to, because we're not out on the streets to know. And so, is there really a need? Like, we don't know because we're not in that social service aspect, but we're here to help then coordinate it. So,
I know Mount Vernon Police went yesterday to the homeless camp areas that they know about, and we're checking on people, so.
but yeah, we didn't hear anything after that.
And I
so.
talked to some of the other counties, Richland County, went right out real quick and started opening shelters, and then in 2 days, they're advertising on Facebook needing volunteers, cause
They say manning it.
they
you know,
can't staff it.
employing it, staffing it,
Yeah.
yeah.
So,
Yeah.
fire departments, they, like to jump on board and open their doors, their training rooms, but they've got a training room with thousands of dollars worth of equipment that they've got to task
Mhm.
someone that was supposed to be on a truck that day was sitting in there and monitoring, and it's hard to do that. Now, our mandated activation is usually based around that electric power. So if we know and there's going to be extended power outage, that 6, 8, 10, 12 hour extended power outage. That's when we're gonna, use our leverage to say, no, we need this. We have to have this in the community. And there again, that's where our CERT folks might be able to, assist with some staffing, so.
Well, thank you.
Yes, any other questions?
What do you think?
I want to tell you, JT and your staff, I'm very proud of you guys. I think you've done a great job for the community.
Thank you.
We've come a long way. I've followed you guys for a while now. And you've done a great job taking us where we need to be, and you're doing a great job. I wanna thank
Sometimes
you
it's
for
an
that.
uphill fight. We appreciate that. We see those needs because, we're playing that ifs and buts game, and not all the time do people want to hear that, but when you sit down and you do an exercise and you pose a scenario that's plausible, we've done some that we're like, well, this might not happen in Knox County, but you never know.
Yeah,
Well, you start those conversations with all the partners at the table and you throw one little wrench in it's outside of their sandbox, right? Well, who do we need to get help from for this? And then they get to talking to that agency, says, well, that's something we do. oh, well, I didn't know that. Well, then you bridge that gap, you create that relationship, they're shaking hands now, I can walk away.
Yeah.
I don't have to be there to keep them talking, you know, and that really helps. It goes a long way. And there again, that takes that pressure off of us, and we're not micromanaging all these little things because they're handling it themselves. We can, you know, do the tough work then.
Yeah,
So,
very commendable, thank you.
well, thank you.
Yes, thank
You
you.
have something else?
I just was gonna ask you what you thought of possibly partnering with some of the services. We were just listening to the Adam program and the addictive recovery services, those type of things. I just wondered if they were offering, like, as part of their arrangement of receiving funds and partnering with the county to be able to help people, if
We
they
already-
offer
We already
something,
do.
they do that good.
Yes,
Good.
we partner with them,
Good.
our counseling services, acute trauma care, like reunification. The school counselors aren't trained in acute care. They're used to talking to the kids having problems at home, not the kid just saw their best friend get injured or killed, right? So bringing them with their ability to get some training, talking to us, what kind of criteria do you want to vet your people that you're gonna allow into the reunification process, things like that.
I was even
Our
wondering about the
CISM.
like, you know, in the extreme temperatures, if there's any facility that they might have that we could utilize to open. And
All
they,
their offices are in Licking County, I believe, aren't they, based on?
Outside of Freedom Center or something. like
right.
that.
Freedom
Well,
Center,
yeah,
some of
yeah.
those.
But once again, you're opening up a public facility with.
Well, and patient rights, cause you've got people going in and out for
Right.
services that day,
Right.
so. And there again, that's something you have to talk through with people, what can and can't you do, so.
Mhm. Because some of those people need mental health services, they may not be connected to them, so if they know there's a shelter open there and they can actually get help or get out of the cold, it might make a connection between them and the service they need too, possibly. If they're homeless and
Yeah.
their mental health issues.
Yeah, we all service the same folks sometimes, so.
Yeah.
Yeah.
All right, well, thank you.
Thank
Thank you.
Thank you.
We won't make any promises about the weather.
Okay.
I was waiting on that.
Promise it'll be.
You see what's falling out there today, and that's not coming off the roof.
We should be used to it, you know, we
I
were
know.
lucky, it went away for a few years, but we're still in Ohio.
Yeah, exactly.
There was a 22 degree difference yesterday, because it was -11 when I went into work and came out, and I'm like, what's warm? Yeah, it was only
I
11
went and bought,
degrees.
I went and bought bread just for the Wonder Bank and put my boots to keep my feet dry.
You're telling your age. I follow a comedian on Facebook that we've seen numerous times at Funny Bone, and he's in Louisiana. And he did a bit yesterday on his back
Oh,
porch. He's
that,
like,
yeah.
you see that? That's my yard. That's snow.
And my sister lived down there.
Have a good
Okay,
day.
thank you, guys. Okay, so
Okay, we'll
Jason,
go
we're back to resolutions then.
So we need to have you approve the Knox County Litter and Recycling 2024 financial report, and this is for Matt Walker's position that's funded by DKMM. This is just a requirement that they require each county to submit this at the end of the year, so we have that ready and for you to approve and for Bill to sign.
So take a motion for that.
I motion for it.
A second.
And those in favor, say aye. Aye.
The,
You sit on that committee, right?
Well, that's, we all do.
Okay. I thought you didn't have it, doesn't. Okay.
then we have approved the State of Ohio Department of Development. This is the Community Development Block Grant, and this is requesting the release of funds to the state for the federal funded project, the Dandel Memorial Park improvements. This is relating to park improvements and that bike access across the road improvements. So this will release the money to the state, and then when the project gets going, then you will sign a draw request that'll send the money down locally to pay for that work. So this is kind of step one.
The motion to approve.
Connector.
Yeah, and the park.
I motion to approve.
Second,
A second.
all those in favor, say aye. Aye.
And that just requires one signature on that. And then we also have related to that project, the approved the Ohio Department of Development certification for exempt projects, and this is just required, or lets that be an exempt project from excuse me, sales tax for the contractor that's doing that work. So this is just to approve that and would require one signature.
Take a motion,
Motion approved.
I second.
and all those in favor say aye.
Aye.
And then we have proven advertisement, the Mount Vernon News advertisement for bid for the Knox County Engineer 2025 roadside mowing program.
Make a
To put
motion.
this out to bid.
Second.
Okay, all those in favor say aye.
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 We have a utility permit on Flat Run Road. This is for Spectrum to do some boring along that road.
Motion,
I motion approved.
Second.
all those in favor say aye.
Aye.
And that requires all three of you to sign on that. And then the county engineer has two items. The first one is the LPA Federal State Exchange Agreement, and just to kind of give you a little bit of an idea of what this is, the LPA, so these projects are federal funded, come down to the state, they can either be done by a local public agency or the state, and since Cameron and one of his staff are fully qualified through the state, we can handle those projects locally, instead of ODOT running the project. And this is for just the construction, not for design services, so Cameron, the county engineer, Cameron Keaton, will pay for the design services out of his budget. And this gets this project going, which is Mile Creek Road. Just to kind of let you know, these take up to 5 years to get through all of the process, so this probably won't go to construction until 2028. But it's $1,069,700, and that has a 95.5, so the 95% is federal funded down through the state, and then Cameron, the engineer's budget would pay the other 5%. So that's the first one for you to approve.
Motion to approve.
Second.
Okay, all those in favor say aye.
Aye.
And that just requires one signature. And then the second one is the same thing for the LPA, and this is related to a bridge south of US 36 and Kenny Road intersection. And this one would be in the amount of $1,969,600. And again, it is a 95.5 grant. And again, it'll be probably construction year 2028.
Take a motion,
Motion approved.
Second.
all those in favor say aye.
Aye.
Okay.
Then I have just a couple items for you today. The Fair Board, I think everybody got the email from the Fair Board, was asking if you were available to come out on Wednesday, February 5th at 7 o'clock to just, they would kind of introduce you, let you do an introduction, and then you can leave. You don't necessarily need to stay for the whole board meeting. I know Barry, you had responded to them that you were available.
Right.
Bill and Graham, are you available?
I responded as well.
Okay.
That's kind of available, especially if it's not the whole evening, we have a commitment later, so that helps.
And you'll get that then on there. On their calendars. Okay,
Mhm.
thank you. And then the other item I had this week, so you may or may not seen these yet. If CCAO doesn't have your emails, we'll get it, but. So CCAO, every Friday, they put out a State House report of kind of what's going on over at the State House. And one item I pulled off for you to read, kind of in particular, was they did a spotlight on children services placement costs in the state of Ohio. And it talks about there's 53 counties in the state of Ohio that do have children's services levies, like Knox County. And it kind of goes through the kind of the rising costs that counties are seeing, and it discusses placement costs and how that's affecting counties. And it does say that CCAO, which is your, lobbyist group, is working as a priority this year, as a top priority, to discuss with legislatures about how that affects county budgets and so forth. So made copies of that for the three of you that's related to that topic. You're welcome.
I think it's along with our discussion.
Yeah, I thought that was kind of good timing after Scott was just in last week, so.
Sure,
And then-
copy too.
And then the maps. The map department has the new maps are out. I don't know who uses maps anymore, but like this kind.
I needed one in DC.
Yeah.
It showed me electronics and all that. It's not helpful when all services are shut down.
So here are copies they have given us, so if you want some or disperse them or something, and then. Obviously, we've got new updates through the county offices, and he's got plenty more, he said, if you need them. But those are out, hot off the press, so.
Thank you.
I think that's all the items I have when we're done. We're gonna finish up the building tour today, I think, wrap that up, and then you have your orientation this afternoon, so. Yeah, it is.
Mhm.
And I think short of that, that's all I have for you. Here is your minutes to approve. And then you are signing, we talked last week, this is you actually signing the transfer, moving the $146,640 to the budget stabilization fund that we talked last week, of moving that into, we're allowed to put up to 5% of prior year revenue.
Mhm.
So that are that's these two documents you're signing here to make that transfer. Okay.
So Brenda, Barry, you have anything, commission wise, to share?
I have nothing new, Rick. I mean, I haven't been to any. Boards or committees. I'm going to the Woodward at 3 today for a board meeting, so.
Just I went to DC and witnessed the change of the guard. And it was great.
I don't know whether, did you receive the Jeff Pickrell information about the wastewater assessment? That's the little Jellaway, which is, you know, basically Apple Valley, that they can tell by the wastewater what diseases that we have going on in the county, and the SARS COVID number 2 is normal. Influenza and RSV are high.
That was a 500% increase. It's so
Yeah,
crazy.
big increase, yeah. See what else they had, and then they had also. This other one, but the RSV is high according to the POO system that we have.
What they found with that is through COVID, this state Department of Health found that could test that treatment facilities.
Mhm.
And so they asked for some volunteers. And I think the county's doing, I think this, and the city of Mount Vernon is doing it.
I think Gamber is too.
Gamber as well.
Mhm.
So, yeah, that is interesting information when it comes out. I mean, it's like a week behind, obviously, but it still shows spike in influenza, which is interesting.
And then I went to a work dev committee meeting yesterday out at the Career Center and did a tour there, but we'll get information from them as we go along. And we'll sign our things here. We'll do our tour of this building and take a motion to adjourn.
My motion to adjourn.
Second.
Okay, we stand adjourned at this time.